Today on Primary Care, HIV-AIDS. We take a look at the disease that once paralyzed the world with fear.
I just knew I was going to live, and I needed to find a way to live, not die.
Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care. Despite the fact that stories about HIV/AIDS no longer dominate the local and national news coverage daily, as it did in the 1990s, there is still an epidemic and African American women are most at risk. The truth is, while there is no cure, medical treatment for HIV/AIDS has improved greatly. It is possible for a person with the virus to live a normal or near normal life for years and even decades. The keys to living with HIV/AIDS are getting tested, following doctor's orders, and taking medication as prescribed. Here to discuss the AIDS epidemic in the 21st century is Dr. Paul Benson. Dr. Benson heads the Be Well Medical Center in Berkeley, Michigan, and is credited as an HIV specialist by the American Academy of HIV Medicine. He has traveled throughout the world meeting with scientists who are researching the disease and keeps him on the cutting edge of medical advancement. Dr. Benson, welcome to the show.
Thank you very much.
Thank you so much.
Pleasure to be here.
We are honored to have you here.
Thank you.
Excellent. Tell us where we are right now in terms of HIV in America. Where are we in terms of our understanding of the disease and our approach to the disease?
I think we're a little behind times with the understanding of the disease. It's no longer a killing disease, it's a chronic manageable disease. People need to take their medications every day as if their life depends upon it. And the medications are not toxic, they're easy to take. So I'm glad that I started practice in 1980, where it was a disease of people dying, living from one Christmas to another. And now it's a chronic manageable disease that people can live a normal life.
So, you know, we've learned a lot from your lectures in the past, but one thing that really stands out is African Americans are at a higher risk for this disease, even though we're only 11, 12% of the population.
Yes.
But we're at a higher risk, a disproportionate risk of developing this disease.
Disproportionate.
And African American women even more so. Why is that?
I'm not really sure. There's probably multiple reasons. I think the African American community do not go to their primary care doctors. There may be some denial, there's lack of trust, and they just don't get tested. And I think the African American community needs to start educating each other to go out and get tested. We can cure this disease, we can eliminate it, but it all starts with getting tested. The World Health Organization has a plan to eradicate the disease by the year 2030, and they're looking for 90% of the people that are HIV positive to get diagnosed, to go out and get tested, 90% of those to get treated, and 90% of those to have successful treatment where they're undetected in their viral loads. We can do it, we just need to get the education out there, and I think the African American community, through the churches, through the communities, needs to go out there and get some testing programs in place.
Should not be a silent conversation anymore. It should be something that we actually talk about in open, succinctly to people with definition. If we can get to 90, we can get to 100 or close to it.
Absolutely. Unfortunately, there's still a lot of stigma in this world, and a lot of people living with HIV live with shame. And because of that, you know, they're just not going out and getting tested. They're scared to tell families. People still, you know, it's not where it needs to be.
What are some of the myths that still exist around this disease? You know, we have myths that we have to dispel with patients every day in medicine. You know, they've got antidotes and, you know, all kinds of home remedies. But what are some of the myths about HIV that still exist that we need to overcome?
I think the biggest myth is, especially in the adolescent population, where they say it could not happen to me. Many myths is that if you're not a gay individual, you're not going to get it. And in fact, we're seeing that it's more heterosexual women, especially African American women, that is accelerating in the amount of cases that are newly being diagnosed. So that's the big myth, is it cannot happen to me. It's only for gay people, it's only for IV drug users. That's far from true. It can happen to anybody.
So with African American women being disproportionately affected by this, maybe that should be one of our targets in terms of education and getting the story out.
Absolutely, and especially in primary care. The primary care doctor needs to talk and take a detailed sexual history on all of their patients, especially African American women.
Regardless of age?
Regardless of age, because people in their 60s and their 70s are sexually active as well. And doctors like to sweep this subject under the rug because it takes time and energy to talk to a patient and find out what's going on with them. But that's really where it starts. It's amazing how many primary care doctors do not talk about sex to their patients.
Let's dig into the disease a little bit, Paul. When does HIV progress to AIDS?
So HIV progresses to AIDS if you have something called a CD4 cell go below 200. A normal level is above 500. Also, if you develop an opportunistic infection that a normal healthy person would not get, things such as certain types of pneumonias or meningitis or skin cancers, a number of these conditions, if somebody was to get them, they would then be defined as AIDS. But the difference between AIDS and HIV is only a word. It's a spectrum. The treatment is still the same.
No matter.
No matter.
Okay. No matter what the outcomes have proven, we still need to start with the treatment being the same.
Absolutely. And we need to start treating early. We used to wait until somebody's immune system became compromised at a certain point and then start treating them. Now it's like test and treat. If you're positive, we treat you.
We now have a unique item that has been inserted into this whole discussion as well as the treatment, and that's PrEP for pre-exposure. Can you talk to us about where the primary care physician needs to be instituting that particular treatment?
Sure. There's an HIV medication called Truvada, and given to people that are at high risk who are HIV negative, it can prevent HIV. The studies have clearly shown that it does offer an additional layer of protection, of course, in addition to the use of condoms, which sometimes that message doesn't really get out, and there's inconsistent use of condoms. So Truvada is one pill once a day, and it is effective in preventing HIV. It does not prevent other sexually transmitted diseases, but it does help prevent HIV.
So we know over at Be Well, you also not only focus on the medical treatment and the medical aspects of this disease, but you also look at the social aspects, which are very important for patients in this society who may have contracted HIV/AIDS. Tell us the Be Well approach, the Berkeley Be Well approach.
We treat people as individuals. We love to have them bring in their partners or significant others. We don't care about their sexual orientation whatsoever, but it takes a team to take care of an HIV patient. I'm fortunate that I have case managers there for those people that are underinsured or have no insurance to be able to get them what they need so they can take their medication. I'm real happy to say that in my center and most centers, it's available that people can take medication. I have nobody that cannot be on medication because they cannot afford it. There's multiple number of Ryan White programs and other programs that help people, get their drugs and their medical care paid for.
You're saying 100% of the population that you treat are getting the drugs properly?
100%. Thank goodness that I have case care managers in my office to get those social workplaces done.
Part of the problem in medicine for years is we've tried to separate disease states from the social part of it. We learned that early on in psychiatry and with psychiatric approaches to treating patients without addressing the social status and the social conditions that existed around whatever disease they had. And that now has bled through to a lot of disease states, and it's most important in HIV/AIDS patients.
Yeah, absolutely. It takes a team to take care of any disease, but especially HIV.
So here again, treatment is available. We have to make sure that we tell this story properly in order to get the message out also.
Not only is treatment available, but studies have now shown that effective treatment will stop transmission of the virus. So if I can successfully treat a patient with medication for 6 months, they cannot spread it to anybody else. And that's something that's called undetectable equals untransmittable. And it's new news out there. Most people are not aware of it.
That's great. Hold that thought. We have to go to a break. Coming
Trying
up
to
on
keep a
Primary
positive
Care,
outlook.
you'll meet a Detroit woman
Because
who
since
has
I've
been
been in
living with
Michigan,
HIV for
it's been
25
rough.
years.
All across the country, people are coming together to speed up what we can learn about health. The All of Us Research Program is calling on 1 million people to join us as we try to change the future of health. For your family, for future generations, for all of us. Visit joinallofus.org and find out how you can become 1 in a million.
I am a mother.
I am an entrepreneur.
I'm a journalist.
I am a singer.
A businesswoman.
I'm an artist.
An educator.
A sister.
An advocate.
A leader.
A queen.
I am a friend.
I am.
I am.
I am.
I am.
I am.
I am.
I am one of more than 1 million people living with HIV in the U.S.
We are not alone. Let's stop HIV together.
Get the facts. Get tested. Get involved. In the 1990s, HIV-AIDS was in the news daily. The epidemic, the deaths, and the lack of a cure. Today, there is still no cure, but having HIV-AIDS diagnosis does not automatically signal death. While the virus and the disease are still a major issue in America and the African American community in particular, treatment has progressed and many who have the virus are living productive lives. Andrea George is one of them.
I was diagnosed with HIV in 1993 by a community health center. It was a counselor gave me the results. Prior to me going to the community health center, I was married, and my husband was in jail for 3 years. He came home and he told me that his friends that he was shooting drugs with were dying or dead, and that he needed to go get an HIV test, and I should also. So they tested him, and his results were positive. And back then you waited 2 weeks for your results. It was a long 2 weeks. So then after he tested, I figured, if you're positive, I gotta be. So then I went and got tested and got my results. Of course, I was positive. Well, my first thoughts were that I didn't want to die. And I had already done research because of him being positive. So I was going to the library and reading up on different things. And as much as I could find in 1993 about HIV, it wasn't a lot. And I just knew I was gonna live. And I needed to find a way to live, not die. Then I went to another counselor who told me that you shouldn't get pregnant. You shouldn't have any children because your children will be positive, and if you have kids, then you're gonna have to have a cesarean. All this scary stuff, he told me. So I thought I couldn't have kids. And I practiced safe sex, and I didn't get pregnant until I started doing some research. And I found out about a clinical trial. They were using AZT on pregnant women to help stop the transmission to the unborn child. So I went into that clinical trial. It was a matter of me having a positive child or taking this medication. So I decided to take the medication. Wasn't too happy with it, but I took it. That was the first time I had ever taken medication. So this was in 1996 when I got pregnant with my daughter. When you're living with an illness or disease, you have to have a support system. So support groups for me worked. Like, they really worked. And I still have my support system. 25 years later, well, a few have passed on, but I still have them in my life. In 2007, there was a movie that was on HBO. And it's about my life. It was written and produced by my brother. Queen Latifah plays me. It covers so many issues. It's domestic violence, drugs, the lowdown, mother-daughter relationships. It's just so much in that movie. And it's just so much you can get out of it. If you let HIV and the whole idea of it get to you, you'll die. I've seen it happen to a lot of my friends. They just got tired. They got tired of taking pills. They got tired of doing dialysis. They just got tired, and they let themselves go. So in order to be able to manage HIV, you have to understand that it's in you, but it's not you.
Mrs. George did a lot of research at the time of her husband's diagnosis. What are some of the things that women should know before they contract the disease?
They should know that if they're sexually active, they're at risk, and they should be empowered to insist that their partner use condoms. They should know their HIV status, and they should know their partner's HIV status. Those are, very important things.
Stigma. We touched on it a little bit earlier, but has the stigma associated with HIV-AIDS hindered our ability to control the spread of the disease in any manner?
Absolutely. Stigma is much less than it was in the 1980s and 1990s. However, it still exists, and it's something that we're breaking down slowly but surely. Many people are in denial, and they don't want to tell people that they're HIV infected. They don't want to get tested, and again, it's all because of stigma.
This patient was able to have a baby in the 90s, and the baby was free of HIV-AIDS virus at that time. If a woman wants to start a family in 2018, 2019, what should she do?
She should see her OB/GYN doctor and get an HIV test. And even if you're HIV positive, you can bring up a negative HIV child by taking HIV medication and being undetected. So the risk of transmitting HIV to a newborn is very, very small as long as the HIV is detected and treated in the mother before
getting pregnant.
Before getting pregnant.
Right.
Yes.
So, but here again, like in a lot of other disease states and transplant patients, folks get tired of taking medications every day, this lifelong sentence of taking these drugs. Over at BUL, I'm sure that's a issue that has come up in the past.
Having patients take their medications is our #1 priority. We can treat them and guarantee them a healthy life as long as they take their medications every day. And dealing with the adolescent population, very difficult to do. We now are able to tell people, though, if you take your medications every day and are undetected, you cannot transmit the disease. And that messaging is helping a great deal with adolescents and everybody to take their medication. It's nice to know you cannot transmit the disease to anybody if you take your medicine every day. If you talk to an adolescent and say, you need to take your medication every day so you can live 20 or 30 years from now, they don't really get that message because their adolescent brains can't go that far in advance. But if you tell them, if you take it now for the here and now, you can't transmit, it turns out that messaging is helping a great deal with having people take their medication.
We're going to go to another break. We'll be right back with more primary care and Dr. Paul Benson.
The All of Us research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
If we delve deeper into where we live, what we consume, what we do, that will have an impact on trying to prevent diseases in the future.
Precision medicine will allow us to get the right medicine at the right time for the right person.
Diabetes, high blood pressure, obesity, illnesses that Black women get and die from needs to be researched.
This isn't going to be some sort of Tuskegee experiment. This is going to be the community working together with healthcare institutions.
Welcome back. We're here with Dr. Paul Benson, the family HIV specialist personified in this community. Dr. Benson, you are one of the few primary care physicians who specialize in HIV care. How can primary care doctors do a better job of advising their patients about this disease?
I think the one thing that a family doctor needs to do is to talk about it, and most physicians don't. They sweep that subject under the
That's
rug.
very true. We act like it doesn't exist sometimes.
Exactly. So if there's any one thing that a doctor can do, it's talk to the patient and take a sexual history. It's just that easy. Many patients are fearful of bringing something up. They come in with a ticket of admission, something totally irrelevant, and then towards the end, they finally get to what they really came into the visit for. If a doctor is themselves and just speaks naturally without any stigma and just asks questions, are you sexually active? Do you prefer to have sex with women or with men? Have you ever had a sexually transmitted disease? Do you use condoms consistently? Just ask the questions. People would love to talk about it if they feel their doctor is comfortable asking.
It's sort of like erectile dysfunction, which was not a problem until we had a treatment for it. Exactly. And now it's kind of like an open discussion where it used to be quiet if it was said at all. We need to raise the volume on this.
Exactly. Although I'm finding that a lot of my men are coming in requesting and asking for it, so they're not shy to ask anymore because they know there's a treatment.
They know there's a treatment. Exactly. And so if we can get this message out, maybe we can advance the conversation with our patients. Let's dig a little deeper.
Sure.
Black gay men, men having sex with men, represent a particular area of involvement.
Yes. I don't believe many African American men that are gay realize that their chance of getting HIV in their lifetime is 50%. That's one out of every two. One out of every two. And they're clueless. They live in the thing, it can never happen to me, it's somebody else. Many African American men are living on the down low. They just don't think it could happen to them.
That's an interesting statement, simply because I don't think we made a lot of progress in that particular subset of studying this disease. It seems that 1 out of 2 is more than it has been in the past. Is that correct?
It's been about 1 out of 2 for a while.
Okay.
But again, that's a very, very high number, especially compared to white men where it's like 1 in 200.
Yes.
So that disparity needs to be addressed. I don't think the healthcare system has been doing an effective job of getting that message out. And I think that the African American community needs to take it in their own hands to get this message out as well.
That's very important. Since we're talking about treatment a little bit here, tell us what's the makeup of a cocktail. People, the patients even will talk about a cocktail. Tell us what that really represents.
Sure. One drug by itself is not enough to eradicate HIV, so we now use 3 different medications, usually an integrase inhibitor or a protease inhibitor mixed with a couple nucleosides. And the nice thing is we have all these cocktails now into one pill. So for most people, it's 1 pill once a day, even though that cocktail is mixed into that 1 pill. And the nice thing is, it's non-toxic. People could take it the same as a vitamin pill. It's not going to make them sick. Older people have the misconception of thinking HIV medicines make you sick, you can't take it, you have nausea, gastrointestinal issues. There are enough medications out there right now that we can find one for everybody that they just take and it doesn't make them ill. In fact, it saves their life and keeps them healthy.
How about that? You know, all of this discussion, the underlying message seems to be that there needs to be a trust factor here with our patients. The trust that they have in us to not only bring up the subject and discuss it, but also the trust factor in who we refer them to continue their treatment and continue their follow through with this disease states. You know, that is something that might be the trouble that we're having. We have not built the trust yet to actually be effective.
I think every doctor's office, especially primary care, should be a harbor of safe being for people to walk into where discrimination and stigma, political preferences are all left out the door and checked out the door, that people can come in as people and can have open, honest relations with their primary care providers and not be scared to tell the truth. Because if somebody is hiding something from their doctor, I can't help them that well.
Good. We've been here talking with Dr. Paul Benson, who is Associate Professor of Medicine at Michigan State University and also Director of the Be Well Life Center in Berkeley, Michigan. Paul, this has been outstanding. We thank you so much for the time and being here with us today. We will do this again. Thank you so much.
My pleasure.
Excellent.
Thank you.
Excellent. Stay with us. We'll be right back for some final thoughts after this.
We are one nation, one people. When called upon to give from within, we come together and find that our capacity to help others is limitless. Here, we are fearless. What lies inside all of us is more than data. It's life. It's more than insight and medical research. It's vision and honor and compassion. What's flowing through America's veins is its diversity. The next great breakthrough will be found in each and every one of us. And what we find there will unlock mysteries, heal the sick, and eradicate disease. We ask for 1 million individuals to come forward and stand on this landmark in history. We ask America to do, once again, what she has always done. Lead the way forward. We're one nation, one people, but all of us are different, and it's those very differences that will lead to answers for generations to come.
My final thoughts on HIV-AIDS, a disease state that has been pushed to the background that needs to be brought into the foreground simply because it has not gone away. We cannot let our social media distract us from the necessity of making sure that our communities are educated about this disease state. We need to shed more light on HIV-AIDS, and it's our responsibility to do that. Thank you for watching. We'll see you next time on Primary Care.